There's this hidden epidemic that touches millions of lives, but so often it stays completely in the shadows. We're talking about violence. So in the next few minutes, we're going to shed some light on its many forms, who's most vulnerable, and this is the important part, the signs we can all learn to recognize.
Okay, let's start with just a number, 1,500. So what does this number even mean? Well, this isn't some dry statistic. This is the number of people who die from domestic and intimate partner violence in the United States every single year. It's a really sobering reality, and it's exactly why understanding all of this is so vital.
Look, domestic violence can happen to anyone, no matter their gender. But the data here, it shows a really stark and critical difference. While 1 in 10 men over 18 will experience it, that number jumps to a staggering 1 in 3 for women. And understanding this isn't about minimizing anyone's pain. It's about recognizing where the risk is just so much higher.
Now, to really grasp the true scale of this problem, we have got to look beyond the physical. It is so much more than a bruise. A real understanding only starts when we broaden our own definition of what violence and abuse actually are. It's really a spectrum. Professionals usually break it down into 5 main types. You've got physical, sexual, emotional, neglect, and economic abuse. And it's so important to realize that violence isn't always something you can see. In fact, some of the most damaging forms leave no physical marks at all.
Let's just zoom in on one of the most invisible forms for a second, economic abuse. This is such a powerful tool of control. It could be anything from stopping someone from getting a job to controlling every single penny they spend or even taking their assets. What it does is create this state of forced dependency that makes leaving feel, well, basically impossible.
And that brings us to something absolutely crucial. Every number, every statistic we've seen so far, it's really just the tip of the iceberg. Because of fear or shame or just direct control, only a tiny fraction of abuse cases ever get reported. The true scale of this problem is hidden, and it's probably much bigger than any official numbers could ever show us.
So, if the problem is way bigger than we even know, it's vital to understand who is the most vulnerable, right? While violence can absolutely affect anyone, the data is very clear that certain groups are just disproportionately at risk.
The 3 populations that are identified as being most at risk are women, as those stats have already shown us, children, because they're completely dependent on their caregivers, and the elderly, who might be facing a similar dependency because of physical or even cognitive challenges.
For kids, especially the ones who are too young to speak for themselves, one of the biggest red flags is when the story just doesn't add up to the injury. A caregiver might have an explanation, but the injury itself tells a different, more concerning story. A pattern of frequent or unexplained injuries is a huge signal that something could be seriously wrong. Now, for the elderly, the most common form of abuse is often neglect, things like withholding care or food or assistance. And because of that, the signs might not be physical at all. Instead, professionals look for behavioral clues. A sudden onset of fear or withdrawal or just unexplained anxiety can be just as telling as any bruise.
Okay, so we know what abuse is and who is most at risk. Now let's get to the human side of this. What are the behavioral signs we should be watching for, both in the person causing the harm and the person who's experiencing it?
There's often this devastating psychological dynamic at play. On one side, you might have a perpetrator using threats and intimidation to stay in control, maybe driven by their own history of trauma or substance abuse. And on the other side, the person experiencing the abuse is often left with feelings of low self-esteem, helplessness, and this crushing, totally misplaced sense of guilt. It's a really powerful and destructive cycle.
Now, while not all abuse is physical, when it is, there are key signs to look for. And maybe the most telling indicator of all is this: injuries in various stages of healing. Look, anyone can get a bruise from an accident, but a pattern of old bruises mixed with new ones, that suggests something else entirely. An ongoing problem, not just a one-time event. Things like burns and bite marks are also huge red flags.
So when these signs are identified, what happens next? Well, the most important thing to know is that no one has to face this alone. There's a professional, coordinated system of care designed specifically to support and protect people.
Helping someone get out of a violent situation is never a one-person job. It takes a whole dedicated network of support. A multidisciplinary team comes together to provide this comprehensive safety net, making sure a person's physical, emotional, and legal needs are all being met.
And this support, it follows a really careful process that's built on trust.
It all starts with ensuring absolute privacy, a safe, confidential space where someone can speak honestly. From there, it moves to therapeutic, non-judgmental communication, really careful documentation, and finally, collaboration with that wider team to create a real plan for safety and healing.
And that collaborative team is extensive. It's designed to cover every possible angle. You've got medical providers for physical care, social workers for resources and safety planning, mental health professionals, chaplains for spiritual support, and even law enforcement for legal protection. It is a truly holistic way of providing care. Ultimately, it all boils down to this: awareness is power. All the systems of support, all those dedicated professionals, they can only start their work when someone recognizes there's a problem in the first place. Seeing the signs is the first and most critical step to breaking the cycle of violence and letting the healing begin.
So we've seen what individuals can look for and how professionals respond, but that leaves us with one final and really crucial question. Knowing that awareness is only the beginning, what can our communities do next to build a safer world for everyone?